On this channel, I talk about the tools, the tips, and the strategies to make money on YouTube. So this video is a little different than my normal content, but since COVID-19 is dominating the world right now, especially the vaccine, I wanted to give my honest feedback regarding my experience with the vaccine. And let's face it, one tip for YouTubers is to stay healthy so you can keep making videos. Before I get into it, a quick disclaimer: the information contained in this video has been made for informational and educational purposes only. It's my own personal experience with the vaccine, and it's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding the COVID-19 vaccine or any other medical condition. Today is December 23rd, and my wife and I are headed out right now to get the first shot of the COVID-19 vaccine. In other videos, I've talked about my other business, which is I'm a co-founder of a company called Pro Health Medical, and we own urgent care centers in my home state of Michigan. And because we perform COVID-19 testing as well as treat COVID patients, we are considered frontline workers, and thus we had early access to get the vaccine. And I am nervous about receiving this vaccine, but not because of potential side effects. I just really don't like shots. Even though we've seen thousands of COVID patients at our clinics, both sick as well as people who aren't sick, when the pandemic first broke, I was one of the people who thought that the world reaction and lockdown was completely overblown, and I figured if I got the virus, then that was just the luck of the draw, I would get the virus.
Preparing to get your vaccine.
Preparing to get my vaccine. I would still wear my mask in public and practice social distancing because many of my friends and family members took this virus very seriously, as some of them had previous conditions which made them susceptible to getting sick. And I also wanted to just be conscious of the feelings of other people around me. I was also someone who thought that if a vaccine ever came out, that it would be years before I ever took it. You're better than Amanda.
Amanda's gonna see this.
No. Well, that cavalier attitude completely changed one day. So on October 2nd, 2020, a person came into our clinic and wanted a COVID test because he had chills and a fever. So we did a COVID test on him, and we confirmed our suspicions that he indeed had COVID-19. All right, so it's been about 4 hours since I received my shot, and nothing to report. I feel fine. No side effects other than maybe my left arm where I received the shots, just a little sore, but that's really about it. So he went home that day. He was feeling ill, but the next morning he woke up and was complaining not only of fever and chills, but he also had some chest congestion. So he ended up going to the hospital. They ran some tests. They already knew that he was positive for COVID, and they said his vitals were good, but they wanted to keep him there for observation. Well, unfortunately, a week after he entered the hospital, he was put on a ventilator. And a week after he was put on a ventilator, he ended up passing away. So it's been 8 hours since my shot, and I feel fine. My arm was a little sore. I'm a little tired, but I don't know if that's because it's nighttime or a side effect, but I feel pretty good, so I will check back in tomorrow. Now, the reason I know this story is because this patient was one of my best friends, and his passing was really hard on me. All right, so it's been 24 hours, and today I feel good, just really tired for some reason, and my arm is really sore, but that's really about it. No headaches, don't feel sick. Like I said, just kind of groggy and tired, but I don't know if it's just normal or because of the shot, but other than that, feeling pretty good. So needless to say, this tragic event completely flipped my stance on the virus and the vaccine, and as soon as it became available to us, I jumped at the chance to get it. All right, so it's been 48 hours plus since the first shot, and today I'm fine. Arm feels great, not tired, It's a perfect Christmas day, so I am feeling really good. And at the time of filming this, there are currently 2 different versions of the vaccine, the Pfizer version and the Moderna version. And I ended up receiving the Moderna vaccine. So when you get your vaccine, you have to register with this vSafe so the CDC can track if there's any adverse side effects to the vaccine. So I just have to go and fill out this quick little survey here and send it. So I guess I have to do this once a day for the next week, and then I think after that it is 1 every week. I know there's a lot of conflicting information about the vaccine, and a lot of people are afraid to get it. All right, we're headed to get our second shot, and again, a little more nervous than last time because, again, don't like needles, but also I've spoken with some people that have received the second shot, and they had a little bit of side effects this time, so we'll see what happens. But my personal opinion is that the benefits outweigh the risks, especially if we want to end this pandemic. Yeah, that's where I had it last time.
All right, do you want to just get it done before I ask all my questions? We can do this part and then I can ask everything else. How about that?
It's up to you.
Ready for this, then?
No, I don't like needles, but go ahead.
I was going to say, don't stop on me now. All right,
No.
keep that nice and relaxed.
Not bad.
Not bad?
Not bad. She was good too.
Good job.
There you go.
Thank you.
Yep.
This is how we win.
From my personal experience, I've seen patients that are both sick as well as patients that had no idea they had the virus because they had 0 symptoms. All right, it's been about 24 hours since I got the second shot, and let me just say that I don't get sick often, but when I do, I'm a big baby. So keep that in mind when I tell you how I feel. It's definitely a different experience than after the first shot. Let's start by saying that the nurse who did my shot was really nice and she did a great job, but I'm fairly certain she hit my arm with a hammer when I wasn't looking, so I'm gonna have to go back at the video and check that out. And although I can't confirm it, I am fairly confident that I have a fever because I think I can cook an egg on my head. It's kicking so much heat, and I've got chills. And before you ask, yes, they are multiplying, but not in the grease lightning kind of way.
I got chills, they're multiplying.
Now that I said that, I realize that most of you are too young to know exactly what I'm talking about, so Google it. It's a classic movie. There's no way to know how COVID-19 will affect you, and if you get the virus, you could spread the disease to your family, your friends, or other people around you. But getting the vaccine might prevent you from getting the virus, as well as it might help you protect the people around you. And if I spin it back to how it affects YouTube, it could potentially help you not get sick, stay healthy, and keep producing content. Alright, it's been 48 hours since I received the second shot of the vaccine, and today I feel 100%. No issues, no headache, no fever. I'm out on the lake actually with my dog, so obviously no chills. So my recommendation is, if you are going to schedule the vaccine, make sure you have the next day off, so just in case you have any side effects. If you want more information regarding the vaccine and if it's right for you, please talk with your medical provider. And I will also leave links in the description of this video for more information about the virus and the vaccine. Thank you so much for watching, and I will see you in my next video.